Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Dr. Natalie LaScola, Doctor of Podiatric Medicine. Did I say that right? Podiatric?
Podiatric.
I'm sorry. Medicine, and Niki Kirven, LPN, both from Aultman Wound Care Center. Good morning and welcome to the show, ladies.
Thank you.
Good morning.
All right. Aultman Wound Care Center's mission is to educate our community about the services that are available to them. We look forward to speaking with them this morning. We'd like to remind our listeners that our program is available on our podcast. Just go to your favorite podcast app and look for Health Matters with the Medicine Center Pharmacy, and you can subscribe to our program and listen anytime.
Welcome to the show, Dr. LaScola. Please tell our listeners about yourself.
Hi, as he said, my name is Natalie LaScola. I am a podiatrist here at Aultman Hospital, and I work at the Aultman Wound Center. And we're here today to talk about the Wound Center and let everybody know some of the services that we provide.
So, welcome to the show, Niki, and tell our listeners about yourself.
I am a certified wound nurse. I work here at the Aultman Wound Center. And we're going to talk to you today about our wound center.
And so where's the wound care center located?
So Aultman, we actually have two wound care centers. Our Canton location is located on the ground floor of the Aultman Hospital between the Bedford Circle and the Timken Cancer Center. And we also had a wound care center at Aultman Alliance, which is it's in a separate building just outside the hospital.
Okay.
All right. What types of wounds do you treat at the wound center?
We treat all kinds of wounds, hard to heal wounds, pressure ulcers, diabetic ulcers, arterial, venous, burns, trauma, just to name a few. Pretty much any open wound we treat here at the wound center.
You know, I had a patient in the pharmacy last week that told me they had a non-healing wound. Can you describe to the listeners what a non-healing wound is and what kind of a challenge that is for you guys?
Okay, a non-healing wound can be caused by an array of different medical reasons. It can be your circulation. It can be the presence of infection. It can be extensive trauma. It could be a surgical complication. It could be underlying health conditions such as autoimmune diseases. There's many different factors that go into why a specific wound won't heal, and that's our job to figure out what specifically is contributing to your non-healing wound to try to correct that problem.
Okay, does the wound care center replace emergency care?
Absolutely not. Now, the good thing is that we are directly located within a hospital or adjacent to a hospital. So if you would show up, there has been times that patients have shown up to our wound center and we do our intake and evaluation, and then we determine that, this is more of an emergent condition, and we have physically taken people down in wheelchairs to the emergency room to get you there. But the wound center absolutely does not replace emergent care. If it is something that needs to be emergently treated, it's okay to call us. Sometimes patients do show up, but it is not a replacement for emergent care.
So does the wound care center take walk-ins or by appointment only?
It's by appointment only, because a lot of the times at the wound center, we have a specific staff, nurses, all set up to focus on you purposely. And if you show up, a lot of times there's nobody there to treat you for that specific problem. So that's where, if it's something emergent, you would go to the emergency room. But we have taken walk-ins if there's an opening, but typically no.
So, Dr. LaScola, is a physician's referral needed to be seen by the wound care center?
No, it is not. You can just call our wound center, describe your problem, and an appointment will be set up for you. You do not need to have a referral by your primary care.
Okay. Who provides care at the wound care center?
So we actually have a mix of providers, clinicians. We have internal medicine doctors, plastic surgeons, podiatrists, nurse practitioners, an array of nurses, as well as hyperbaric techs.
Is it really across the board, everything you possibly can see, you do see?
Yes. Yeah.
Okay.
So can you touch on, we mentioned emergency care. So you slip, fall, you get hurt, you go to the ER, they treat you, they release you. At what point do you have a wound or a situation where you probably need to be seen by a specialist in your practice? And why would that be so important?
I would say usually, everybody gets wounds from time to time. We get a lot of injuries, sometimes this time of year from tree branches and other things. But if your wound's there for, a couple weeks and it's not healing, there's redness surrounding it, things like that. You notice some, discoloration there, then that would probably be the time that you need to come in and make an appointment with the wound center.
Can you talk about, there's a scary word, debridement. What is a debridement process, and is it uncomfortable?
Yes. So the debridement process, it's basically to remove dead, devitalized tissue, bacteria, biofilm, as well as stimulate activity of growth factors to promote faster wound care healing, and it helps aid in infection prevention. It's not, it can be a little bit painful, but we do use local anesthetics to help with the pain control.
So can you talk about what a garden variety appointment would look like at the wound center for a patient, what their experience would be like, and how it's conducted?
Typically, at your initial visit, we're going to do a complete medical review, history of your wound, how it started, what you have done to treat it, how the symptoms have been presenting. And then we typically start right away on your first visit with the most aggressive and appropriate treatment as possible. Our goal is to heal that wound as quick as we possibly can. We always joke that our goal is to get rid of you as fast as possible. That's what we're trying to do. We want to heal that wound as efficiently as possible. So a lot of times there's a lot of tests that we order. We're looking at the blood flow. We're looking at infection rates. We're looking at a lot of different aspects to try to attack it from all different angles to try to get this wound to heal.
So by the time a patient's either referred to your wound care center or contacts you because they have a non-healing wound, like Niki mentioned, what is a garden variety length? I'm sure it depends on each patient and their situation, but I'm guessing that there's probably a process where it takes more than one visit to accomplish the goal for something that's been going on for a particular patient, right?
Exactly. You are absolutely right that it takes everybody different. It depends on your injury, your health, your medical comorbidities, everything else plays into the factor. Now, we've had patients heal after one visit. Now, we've also had patients that have been there for several years. Those patients typically have chronic conditions.
Jeez.
Their wounds typically heal and they can develop new wounds or reulcerate or reopen. So we would need a crystal ball to tell you how long it typically takes, but each patient is different. But for each, we try to do it as quick as possible. That's what we're trying. That's our main goal for each patient that walks through the door.
So since you customize the therapy or the service to each patient, can you touch on some of the services that you provide at the wound care center to give kind of an overview of how encompassing it can be to treat a patient?
Well, we're going to treat the wound itself. So we're going to have local wound care. You're going to have dressings in place. You're going to have new wound care orders. A lot of times we have dressings and supplies sent to the patient's home. If the patient needs care at home, they can't change the dressings on their own. We'll set up home health to come out to their home to help aid in their dressing changes throughout the week, because we typically only see you once a week. And you're going to have to typically treat your wound at home in some aspects. Now, we're going to do surgical debridements like Niki talked about. We're going to do wraps. There's going to be compression garments. Sometimes we put patients in casts. There's skin grafting techniques. There's hyperbaric oxygen therapy. Anything that's deemed fit for that patient that could feasibly heal them more efficiently, we're going to try to do.
Well, it is time for our first break.
Yes, it is. You are listening to Health Matters with the Medicine Center Pharmacy. We'll be back in a few minutes. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. Did you have one more question, Brian?
No.
Okay. I want to throw something in here. We had a fireman working for us years ago in one of our stores, a retired fireman, and he got to talking about burn patients and from fires and how bad, it really is, to treat these people. Is that something that falls in your pattern of therapy, severe burns?
Yes, we definitely treat burns. We don't have a burn unit at our hospital, but a lot of the times once they become discharged, we'll get patients that have had burns. And a lot of times with those patients, we do a lot of skin grafts on those patients.
Mm-hmm. And I remember one of our famous former senators, that he was a pilot and he fired a missile by mistake on the top of an aircraft carrier and burned a lot of people. And I think that was the beginning of a cream or jelly or whatever that they used on, massive burn people. And that has shown up some time ago in prescription drug pharmacy, stuff like that. And we do use a lot of it, or we did dispense a lot of it. Are you using any newer products in surface burns and stuff like that? Or what do you do with a patient who comes at you that has let's say, not necessarily huge burns, but minor? Any special treatment, anything new that, we don't really see in the pharmacy to resell? What do you know about that?
Either a lot of times we do topical treatments. Now you're probably referring to Silvadene cream.
Yeah, correct.
That's the cream that a lot of people think of when they think of burns. Is we use Silvadene, and it is a great cream. But a lot of times by the time we receive wounds at our office or our clinic, even if they're burns initially, they're treated just as any chronic wound would be, because at that point they're a chronic non-healing wound. Initially they're treated as a burn, but once they have been there for several weeks, a lot of the times they're treated just as a non-healing wound. So we'll use different modalities. We'll use topical microgels, and usually those patients we lean towards skin grafts. Niki, do you have any other products that you think of?
Sometimes we'd use like hydrogel sheets. There's different products that are out there for specifically for burns, because burns, in the initial state, you want to keep them moist, but then after they turn chronic, that's a whole different story. So it kind of depends where they're at in the healing process to what you're using for them.
Okay, another subject that I'm going to throw in here, but it is part of the question. So, hyperbaric oxygen. I had a very good friend who had some oral surgery. Okay, and then radiation was put him really in a big hole, and he ended up in hyperbaric oxygen therapy. Are you doing that here, or are we still sending that out?
Nope, we do a lot of hyperbaric oxygen therapy, and it's treated. We treat chronic wounds, we treat infections, skin graft failures, surgical infections or incisions that are opening up or having trouble healing. We treat infections of the bone with hyperbaric oxygen. I mean, it's also used for things like decompression sickness or carbon monoxide poisoning. It can be used for traumatic brain injuries, radiation necrosis from radiation. We see that a lot for all areas of the body. even sometimes areas that we don't see to the eye that are internally damaged, the radiation necrosis can occur, and then the hyperbaric oxygen can help heal that area. A lot of times we try to explain to the patient that the hyperbaric oxygen chamber is literally like a supercharge for your body's natural healing process. It's not providing any medication. It's literally forcing high oxygen environment into your tissues, and that oxygen, while you're in there breathing that pressurized inside the pressurized chamber, it's going to increase the oxygen content in your blood and in the tissues, which in turns allows your body to do its natural healing. So it can help infections. It can then boost your immune system. It can help with blood vessels, forming new blood vessels and new blood flow. It can literally, it's a mega dose of oxygen for that patient. So if they have any chance of healing, we're just increasing those chances, and it really speeds up the process of healing in general.
I don't remember when this was. It was probably 20 years ago or longer ago, and there were no modern pieces of equipment around. They were using iron lungs that were left over from the polio time, and it was they sent this guy to I think Youngstown was doing it somewhere, I don't know, and it did dummy me, I thought, oh gosh, it was in mouth. Why'd they stick his whole body in the thing, but that is how it's done. Okay, for any sort of wound that needs to be treated with hyperbaric oxygen, you put the whole body in the tank, right, or in the container.
Correct. Yeah, a lot of patients are shocked or surprised when they see it. It's literally a glass chamber that we seal off, and you stay in that chamber anywhere from 30 minutes to 90 minutes, sometimes longer. And most patients are extremely comfortable. They come and they either listen to music or they watch movies because there's TVs in there. A lot of patients take naps. It's very relaxing.
So it's not like an MRI that's real nose.
Yeah. I would say there's like a little white noise, almost like a little fan noise, but that's about it. You're not hearing the MRI noise or anything like that.
You're hearing air moving.
Yeah.
Yeah.
I remember asking him a dumb question like, if it was your mouth, well, what did your whole body in a container in an iron lung for? But the oxygen has to be moved around the body and the blood, so that's pretty much what it was. So, but I thought that was very interesting. So,
as an aside, don't you have to be cautious of what types of dressings and clothing you wear in that environment? Isn't there a risk of static electricity discharge if you don't? Is that right?
Yes. Yeah, absolutely. You have to wear 100% cotton going in. There's certain scrubs that we give you in order to go into the chambers. We do not allow you to take anything in. Basically, we say if we don't give it to you, it doesn't go in. There is certain dressings that can't go in, or certain type of devices, but you'd actually be surprised what all we do allow in. Even if you have a cast or other things, you still can go in.
English.
Oh shoot.
Copyright.
Okay.
Copyright. There she goes.
Okay. Are you saying that there's static electricity inside that container or not?
Well, that's what we're trying. Anytime there's that high flow of oxygen, there's a fire risk. So
sure.
There's all precautions to prevent that. So that's what he's talking about, static electricity. There's a fire risk when there's high flow of oxygen in any environment, in the hospital, in the chamber. But when you're in the chamber, you're under pressurized about 1.5 to 3 times the normal atmospheric pressure. So you have to slowly pressurize the patient. And so it's very similar to scuba diving or going under the water. So that's why we slowly pressurize you, and then we have to slowly bring you back up, because otherwise it can give you problems with your ears. A lot of patients can. Welcome back, Niki.
Thanks.
It can give you problems with your ears and pressure that way. But yes, when patients show up for their hyperbaric treatment, they come there We have a dressing room. We give them their clothes, their scrubs, they change. They'll give them a water bottle,
Yeah.
to have a drink to go inside with, and they pick their movie, pick their music, and they
Oh, gosh.
lay down.
What is the maximum time a patient could be left into one of those units?
Typically, our sessions normally are around 90 minutes. Maybe
Yeah, it's around 90 minutes. It's like a I would say there's
2 hours is probably max.
2 hours max. Yeah, it takes some time to get you to what we call the depth that you're going to. So you have to kind of allow for you to get to that certain depth, and then you're there for like 90 minutes, and then to bring you back to regular atmospheric pressure. So about 2 hours is the most.
Yes, certain conditions require certain depths. So the stronger the depths, it's going to push the oxygen deeper into the tissues. So certain conditions such as bone infections or deep internal injuries, you're going to be at a deeper atmospheric pressure. So everybody's a little bit different.
How often do you treat somebody?
Like
Daily?
how many sessions do you have?
Yeah.
It can be just a few to dozens of treatments. It just depends on what we're treating. It can be 5 sessions. It can be 60. It just depends.
Jeez. And what do they cost?
Oh, you're asking the wrong person there.
Really? Okay.
I don't want to have anything to do with any of that part.
No,
Well,
yeah, honestly, we always run that through, insurance. And again,
sure.
always depends on what your insurance covers and what they don't to, how much it costs, basically.
Yes, the patient knows typically their financial contribution before they go into the chamber. They're going to know whether it's covered through their insurance or if they have a copay or if there's a deductible. Patients know before they go into the chamber. And as that goes for any treatment at our wound center, whether it's a skin graft, patients are always aware of their financial obligation or portions before it happens, because nobody wants a surprise bill for anything.
Yeah. Okay. Is it used a lot?
We got a break for news.
Okay, I know. Okay. Sorry, I took the conversation too far. Okay.
That's fine.
All right, at the bottom of the hour, time for the news. Thanks for listening this morning to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking with Dr. Natalie LaScola, DPM, and Niki Kirven, CWCA. I went to high school with Linda Kirven.
That's my married last name.
Oh, okay. Okay. That's what I figured. Okay.
All right. Well, let's talk about total contact casting. What is that? I have never heard of that.
So total contact casting, it's really the gold standard for any diabetic foot ulcer. It looks similar to an orthopedic cast in appearance. However, its main purpose is to distribute the pressure on the bottom of your foot. And by doing so, it allows your ulcers to heal.
So it's a device you wear in your foot. Is it like first thing I envision is a walking boot? Is that a fair image?
So you actually have a cast, and it's a hard cast. Okay. It looks a little bit different, but then you also have a boot that you wear on top of that cast. So that cast goes inside of a walking boot, you would think of, and they're used in combination together.
So then that leads me to, are you going to need a walker or crutches or a wheelchair, or is it designed to be ambulatory?
It's designed to be ambulatory. Some people, if you do have like severe balance issues, you may need a walker or another aid. But typically, most of our patients, they are just ambulatory with the total contact cast.
So you've talked a lot so far about how you approach each patient differently. And I'm going to assume that you probably see a lot of diabetes patients based on some foot issues or maybe other wounds that are persnickety to heal. Can you share any tips for a diabetes patient, especially on the feet, of how to make sure they take the best care of themselves? I don't want to tell you that I don't want them to come see you at the wound center, but I'm sure that an ounce of prevention is as good as a pound of cure that you guys can provide. So what are some best practices, especially for diabetes patients who may not have the best sensation in their feet to feel when something's not going right?
This really hits home to me because this is what I see every single day. Most of most of my patients with non-healing wounds on their lower extremity are diabetic. That doesn't mean you have to be a diabetic to have a lower extremity wound, but typically with diabetes, the most important thing that you can do, the two things that I really tell my patients to memorize, is control your blood sugars and to look at your feet. Visual inspection is crucial because those patients that don't feel their feet, or they have developed what is called neuropathy, where they don't have the proper sensation, they don't feel pain. If you don't feel pain, you may not know that there's something going on. And the only way that you're going to know is if you look. So daily visualization, control your blood sugars, and protect your feet. And that goes a long way. When I say protect your feet, a lot of people think, oh, I protect my feet, but don't go barefoot. Don't walk around in the kitchen barefoot. I mean, feet have a miraculous way of finding little pieces of glass that were broke 3 years ago. Your foot's going to find it. It always does. So it's much easier to prevent problems. So protect your feet, look at your feet, and control your blood sugars.
Interesting.
Those are the three things I always tell my patients to do.
Is I don't know. It is interesting. You know, I had a patient a couple of weeks ago in the pharmacy who said they had stepped on his wife's she needle points,
Oh,
and he stepped on one of her needles, and he doesn't know how long it was in his foot. So it was just one of those things that makes you think, wow, I don't know. Create good habits and wear your slippers and,
Yeah.
you know, I don't know. It was scary. So
There's actually one thing, a nurse tip that we just kind of give them, and it's the silliest thing, but instead of wearing black socks, wear white socks, because if you have some kind of injury, you're going to see it on your sock.
that's true.
If you
You see some
necessarily
blood.
can't see the bottom of your feet, but you can put your socks on and off, then you're going to notice something on those white socks, and that's going to lead you to know that there's maybe an issue there.
Interesting. What about daily wearing of a compression sock? Good, bad. Some of the socks out there for diabetics are just very constrictive.
Well,
Yeah, and I never could quite figure that out. But you know,
a lot of patients, as far as being a diabetic, the one thing you need to watch for is you need to make sure that you have sufficient adequate blood flow before you compress too much. So you can cause a problem if you have poor circulation. The arteries aren't delivering enough blood to those tissues and you compress them too much, you can cause problems. You can cause ischemia, which is the opposite effect that we're trying to go for. So that's mainly the only thing that we typically restrict. Before we recommend compression stockings and garments at the wound center, we will check your blood flow. We will get vascular studies. We'll do a study called an ABI to make sure that you have enough blood flow to withstand the squeeze. Otherwise, we won't put you in them and we'll send you to the vascular surgeon before we do something like that. But as far as a regular healthy person, a compression garment is fine.
What about do you recommend regular feet examinations over a period of time, or even if they maybe only have minor foot issues?
Yes, I recommend all my diabetic patients to follow up at least every 6 months to a year for a yearly or 6-month diabetic foot check. Even if there's no problems going on, it's good to have that visualization. We monitor your blood flow, your sensation, just a lot of different things that can come up. And other than that, a lot of my diabetic patients will come in even more routinely for things such as simple as nail care. A lot of
Mm.
diabetics can't even trim their own toenails.
Yeah.
And we see wounds created from
Mhm.
a simple act of trimming their own toenails because it's either difficult to do, difficult for them to reach, or they don't have the strength in their hands. And we see injuries simply from that simple task of trimming your own toenails. So when somebody thinks, oh, I go to the doctor to have my nails trimmed, it's not a cosmetic treatment. It is crucial to prevent infections and amputations and a whole host of problems that can come up from that.
Interesting. Okay.
All right. Well, before we take our last break, how about we talk about what a wound vac is and how it can be helpful to a patient trying to solve a problem?
Okay, you want to tell them, Nikki?
Sure. All right. So wound vacs, they're a negative pressure therapy. They're used to promote wound healing. It works by reducing the inflammation. It pulls out drainage and bacteria from that wound bed, and also promotes the growth of new tissues. It's the good thing about them. They're portable. It can be carried just like a bag over your shoulder. They do run on a battery, so you do have to plug them in there. It does have a battery life, but it does allow you to still be mobile while getting the best, I guess, the best thing that you can to heal that wound. It's going to promote the most tissue growth.
Typically, wound vacs are reserved for patients with wounds that are deep,
Yeah.
or have voids, or with tunnels. We're not going to put a wound vac on a superficial burn or a skin tear. Those aren't typically the type of candidates that get wound vacs. Wound vacs are typically for deep wounds with depth or
Mhm.
tunneling or undermining. So a lot of times that will help, the wound vac will help promote that and promote your body to fill in from the ground up. Instead of the skin healing side to side, it's going to promote those tissues from the ground up to fill in.
Okay, break time, I guess. It is time for our final break. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show. How about preventative taking care of your feet? Do you recommend using antifungal powders, topical creams, again, antifungal, things along that line?
As far as taking care of your feet on a general basis, I'll tell patients moisturize your skin, keep the skin nice and soft and supple, but avoid putting lotions and creams between the toes. I'll even encourage patients to dry with rubbing alcohol between their toes because we don't want in between their toes to be damp and moist. That's a perfect breeding ground for bacteria and fungus. So moisturize the skin of the lower extremity, the legs, heels, feet, but not in between the toes. Cotton socks, and like Nikki said, white is a good option because many a times you pull it off and you'll see an imprint of blood or drainage and they don't even realize that it was there. Shoe gear, shoes should not be broken in. Shoes should fit from day one. You shouldn't wait for the shoe to break the skin down for it to fit. They should fit from the first day that you're wearing them because 9 times out of 10, your skin is going to fail before the shoe does. So shoes should fit from day one. A simple trick we usually tell patients to go pick out your shoes and don't go in the morning, go in the afternoon or the evening because that's when your feet are going to be the most swollen. They're normal size because if you go in the morning, your feet are typically less swollen. A lot of my patients will get shoes and say they fit in the store, but now they don't fit. And shoes are very expensive. So patients are very hesitant to throw them out or not use them because they spend a lot of money on them. So go in the afternoon or the evening when your feet are the largest, and that can actually help a lot of the times make sure you have proper fitting shoes. And also go to shoe stores such as, this is a plug for Lucky's. I love to send my patients over to Lucky's because they do a really good job at fitting patients into their shoes that are appropriate, not just for their foot size, but for their foot type, because it makes a difference.
Okay, if you got a standing job, do you use leather shoes with a hard sole, or do you wear like a tennis shoe or something like that for best comfort?
I mean, every job has different requirements of what they're allowed to wear, but you can definitely, if you have healthy feet, that's not so much the problem. Most patients can wear any shoes that they want. If their feet are strong and healthy, you're not going to have an issue. But if you're having pain, then you need to wear a more supportive shoe, and it's going to be patient based. I've many times wrote notes. Can you write a letter saying that I'm allowed to wear my tennis shoes at work? Can you write a script for this? Which seems crazy to me that I would even have to write that for a patient. But some works really want you to wear a certain dress attire, but your health should always come first.
But not wear the, what do you call those rubber shoes? I can't remember, but they're so popular and
Crocs?
Yes,
Well,
Crocs.
Okay, Crocs aren't the most supportive, but sometimes we do have patients wear them. Sometimes like a surgical shoe or a post-op shoe if you have an injury in the back of your heel. I'll tell patients to get a pair of Crocs.
Oh my gosh, no
So
kidding.
we do now. No, they aren't. You're not going to go run a marathon in a pair of Crocs, but post-operatively, sometimes they work well as a surgical shoe.
Okay, that's very interesting. I look at some of the people that wear them that work in our store, and we don't like them to wear them, but they're floppy in the back, and half an inch behind the heel and all that sort of stuff. And I'm thinking, oh my gosh, how in the world could you be comfortable?
They serve a purpose in their own right, but I'm not gonna.
Okay.
So how about this? I want to make sure we cover your contact info and how patients can get in touch with you, and we can do that here in a moment. But I wondered if either one of you had a nice patient story that was a success that really had an impact on you or is memorable, so that you can share that with the community and some of the great things you guys do. You've listed all your tools you have and all the great services you provide. But how about a wonderful story as our parting comments, so that you can spread some good hope and cheer for the community?
Niki, what about our patient that finally gets to go swimming on her trip right now?
That's the exact one I was thinking about.
Mhm.
Yeah. Well, you had done her surgery. It was a bunion ectomy
Yep.
about a year ago. And just due to different things and very, well, I guess would be
Lots of medical comorbidities going on.
yes, lots of medical comorbidities. She's taken a long time to heal, but actually through, different things we've done and being creative and, putting both of our brains together, she actually is now on vacation.
She's very excited to go swimming because
She's going swimming on vacation. Yes.
Mhm.
So,
Yep. A lot of our patients become like family.
yes. I would say that's one of the good things about the Aultman Wound Center is we kind of do what we call like case managing. So we see the same patients with the same nurse like every week. So we develop good relationships with these patients. They do become like part of our family. We hate to see them go, but we also love to see them go.
Mhm.
A lot of them are like, we don't want to go. We want to come back. And we're like, just come back to say hi, just come back and say hello. But we're so glad we got to heal you. But you do miss some of them, you really do.
Yeah, it's a really nice setup how we have it, because the patient knows the nurse, the patient knows me, the nurse knows what I was thinking last week, and it's a very good checks and balances, because Niki might say, hey, Dr. LaScola, you thought about doing this last week. Do you still want to do that? And the patients just get really comfortable, and they're always well informed because there's consistency with their treatment plan.
Okay.
Super.
How can I schedule an appointment with the Wound Care Center? My feet are 80 years old. Sometimes they bark.
Well, if you have a wound, we do have, we have our Canton location, which you can just call the 330-363-4977 to make an appointment at our Canton Wound Center. And then also, if you are closer to our Alliance location, you can call 330-829-8000.
Can you give the Canton number again?
Sure. Our Canton number is 330-363-4977.
Okay. Thank you.
Mhm.
Final question, Brad.
What about website? Can they find you online at Aultman?
Yes, through just the general Aultman website, and there's going to be a wound section. You can kind of navigate the site, but yes, we're listed through there, as well as the phone number, as well as some educational information. So we're on there. I'm on there as well, but my practice is also on there. So we have a private practice here that is a more clinic-based podiatry practice. Me and Dr. Nafziger work here, and you can make an appointment here. I can give you that number. It's 330-433-1258, and that's for Aultman Podiatry. So a lot of times we do funnel our patients from Aultman Podiatry. Dr. Nafziger and I will both bring our patients over to the wound center if there's something that's just a little more complicated and needs some extra help. So this is a good place to start. Sometimes we do start out with my wound care here, but most of the time I'll take it over to the wound center.
Okay. Anything else, Brad?
I do want to correct the Alliance number. It's actually 330-596-7940. That other number was their fax number. So I do want to just correct it. It's 330-596-7940 for the Alliance location.
Excellent.
Okay, thank you very much today, ladies. Thank you to our guest, Dr. Natalie LaScola, DPM, and Niki Kirven, LPN from Aultman Wound Care Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacist. Have a healthy week. See you again next Friday right here on Newstalk 1480 WHBC. Thank you, ladies.